Hi, I'm Dr. Faber, and I'm going to be discussing anxiety disorders in children and adults. The various anxiety disorders include social anxiety, generalized anxiety, panic disorder, obsessive-compulsive disorder is often considered in this category or related category, and in young children, separation anxiety. So let me begin with social anxiety. This is the most common form of anxiety that we see, and in very young kids it may manifest with something that we call selective mutism, a reluctance to speak in the classroom setting, but being very verbal at home or with familiar people. This may then progress to a child or young preteen or even a teenager who's reluctant to raise their hand in class, speak in front of the class. They feel very self-conscious. How do I sound? How do I look? What do people think? And they may avoid doing these kinds of activities, being front center. They may even avoid interactions with peers where they don't know every single person. Another type of anxiety is one we see in very young kids called separation anxiety. And this is where the child or even older kids may be reluctant to, let's say, go to school or go to various activities without a parent available. And it's very important that we reinforce making it to school and entering the building. The child might be given a brief interval where they can contact mom or dad during the day and then continue on with their day. A third is generalized anxiety. This is a tendency to worry to excess, feeling very tense, on edge, headaches, stomach upset, and a tendency to just dwell about worries day in and day out. Panic attacks occur out of the blue. They may present with heart palpitations, shortness of breath, feeling like you're losing control, and these can occur discreetly and then increase over time. And after the panic attack, a person may begin to worry, when am I going to have the next one? That's called anticipatory anxiety. And then they may avoid situations where they think they'll have a panic attack, such as crowded areas, and that's called phobic avoidance. Finally, we have OCD, or obsessive-compulsive disorder. And in OCD, often we have repetitive thoughts associated with repetitive behaviors. But you can have either obsessions and or compulsions to make the diagnosis. So checking, counting, hand washing, these repetitive behaviors might be associated with recurrent thoughts or worries of dirt, germs, etc. So these are the general types of anxiety or anxiety-related conditions. And in terms of strategies, there are both behavioral and medical. On the behavioral side, we often think about something called cognitive behavioral therapy. The cognitive part is identifying and labeling excessive worries or fears, and then learning to challenge or correct those thoughts. The behavioral includes relaxation strategies, using breathing exercises, for example. And then we can use a technique called gradual exposure and desensitization, where it's as if we're creating a pyramid of exposure to situations that become progressively more difficult to deal with. So for example, the person with social anxiety might be comfortable talking with a family member or a friend, but then they can progress to including other people with whom they're not so comfortable, or being a part of situations where there are more and more people. A person with panic disorder might be comfortable in their immediate area, their home or their community, but over time they can learn to experience situations and places that are further away. A person with OCD may benefit from something called response prevention, where they want to wash hands or touch something or count something, but they're prevented from doing so for a certain amount of time. They feel anxious during that time interval and use relaxation strategies, and they progressively increase the time frame during which they will avoid the repetitive behavior. In terms of medical strategies, we'll discuss those separately, but this is an overview of anxiety and anxiety-related conditions. Thank you.